Adding some magic to your therapy and assessment repertoire when working with children and adolescents can go a long way to helping establish rapport, reducing anxiety, and also connecting with teenagers who may feel you do not have much to offer them. In about 30 seconds, I'm going to give you a demonstration of a kind of trick that you can use in therapy that might help with that kind of connection. My name is Dr. Brad Norford, and I'm going to be presenting also with Dr. David Palmater in the near future about how to incorporate magic into therapy. For people who are attending, you'll leave that seminar with learning how to do at least 5 different types of magic tricks, and they won't be impossible ones, such as cam back, but rather simple kinds of tricks that you can learn quickly and have an amazing effect, and can also teach selected patients who you decide maybe would benefit or not benefit from it. That being said, we also talk about clients who would not be good for this sort of thing and ones who might benefit from it. We talk about the research on using magic in therapy in different types of settings. And we also talk about different types of ideas we've used over the years for connecting with different populations, like how to use magic with kids on the autism spectrum, kids with ADHD and other behavior disorders, children with anxiety, and kids with low self-esteem. So sit back and enjoy. I'll give you a demonstration right now with 2 volunteer adolescents, neither of whom are patients in our clinical practices. Hey, before we leave today, do you guys like magic tricks by any chance?
Mm-hmm.
Would you be interested in seeing the trick of the day before you go home?
Okay.
Okay, have a seat. I just happen to have some cards here, just in case you had an interest. And for some strange reason, when I see families here, they actually like seeing magic tricks better than talking to me about their family problems. I don't know why that is, but we'll see if that holds true for you guys too. So I'm going to take these cards. Make sure that this box is like a normal card box. There's no trick compartments or something. And put that down. And I'm going to, I'll take about like half the deck, flip it over, about half the deck, keep right side up, and make a big mess out of them. And then what I want you to do is each pick one card. That'll be your card for the trick. Take a face-up card that you like and can remember. Yourself.
Queen of Hearts. 4 of Spades.
Okay. What I want you to do now is flip your card back over so it's facing down and slide it back in somewhere in this mess. Okay. Sometimes I like to do tricks in here because they can have to do with therapy, actually, believe it or not, and family situations. Like your parents are saying that your family is kind of, compared to other years, having some issues and disarray a bit, kind of having some problems mixed up. And so this deck of cards is now completely out of order. And we can think of this box here as kind of like a therapy session or a therapist's office. So I'm going to take this, put them in here. This will be the therapy. Close it on up, and then I'm going to shake it. I want you to shake it too a little bit. Hold the top and bottom. Excellent. A little bit more. I can hear them all getting put in order. Believe it or not, it doesn't seem like it, but you have just now completely gotten it in order in this box, except for your 2 cards. Your 2 cards are in order one way and the rest a different way. Watch this. What's your card again?
4 of Spades.
And yours?
Queen of Hearts.
Uh-oh. There's the Queen of Hearts. And the 4 of Spades.
What? What?
And that's the trick of the day. All right. You've been a great audience. I'll see you next week.